Hi all, this is Ritka Pathak. In today's video, we will be talking about the role of AI or artificial intelligence in oncology. AI is reshaping the landscape of cancer care by transforming diagnosis, treatment and management. So let me take you all to the adventurous journey where science meets compassion and innovation merges with hope. Artificial intelligence or AI is revolutionizing the field of oncology, offering several applications that are transforming cancer detection, diagnosis, and treatment. With its potential to significantly improve patient care, AI-based devices have gained FDA approval, creating the way for their integration into clinical practice. According to recent studies, AI has been approved by the FDA for various oncology disciplines, including radiology, pathology, radiation oncology, gastroenterology and clinical oncology. Dr. Mihil Bodha, an oncology expert, sheds light on the importance of AI-driven diagnostics as a major step towards personalizing treatments. She explains by integrating AI into diagnostics, we can identify unique biomarkers and genetic patterns, offering guidance for treatment choices and enhancing patient results. AI in cancer prediction. AI and machine learning have shown potential in cancer prediction. Regina Berzile and her team at MIT University tested AI's ability to predict breast cancer risk using 89,000 mammograms from 40,000 women over 4 years. The AI algorithm accurately identified 30% of future breast cancer cases as high risk, while human physicians using the standard model identified only 18%. This indicates AI could be valuable in identifying high-risk individuals and help in early intervention. AI in liver cancer treatment. In a recent study published in the journal Chemical Science, scientists from the University of Toronto and in silico medicine collaborated to create a promising therapy for hepatocellular carcinoma. They utilized an innovative AI drug discovery platform named pharma.ai for this purpose. To achieve this breakthrough, the researcher integrated AlphaFold, an AI-powered protein structure database, into the pharma.ai system. The integration enabled them to identify a previously unknown treatment pathway for cancer. Furthermore, they successfully designed a novel hit molecule capable of binding to this newly identified target without external assistance. AI in genomic sequencing. Integration of AI into the genomic sequencing has shown a prominent potential to transform tumor characterization and personalized treatment approaches. For instance, in cases of lung cancer where distinguishing between tumor types like adenocarcinoma and cell carcinoma can be challenging for pathologists, AI can provide accurate and rapid analysis, helping in more precise diagnosis and tailored treatment strategies. Limitations. While AI holds promise in advancing oncology, it has notable limitations. Firstly, the quality and quantity of data used to train AI models can heavily influence their accuracy. Interpreting complex AI-generated insights can be challenging for healthcare professionals who lack expertise in AI, potentially leading to misinterpretations and inappropriate actions. The black box nature of some AI algorithms can make it difficult to understand the reasoning behind their predictions, limiting their clinical acceptance. Ethical concerns arise regarding patient privacy and data security, especially when sensitive genomic information is involved. To handle data in a responsible and reflective way is important as we navigate the challenges and embrace the opportunities of AI in oncology. We must remain committed to the common goal of advancing cancer care and improving the lives of patients and their families. The future of cancer is here, and AI is at the heart of this transformative journey.